Good afternoon and welcome to the Center for Disaster Philanthropy webinar, Is 2020 Over? Responding to Multiple Disasters Amid COVID-19 and Climate Change. This is Patty McElreevy, President and CEO of CDP. This webinar is co-sponsored by United Philanthropy Forum, Council on Foundations, the Funders Network for Smart Growth and Livable Communities, Philanthropy California, the Iowa Council of Foundations, Southeastern Council of Foundations, Grantmakers in Health, and the Community Foundation of Southwest Louisiana. Some reminders before we get started. The webinar is being recorded. It will be available on our website and YouTube channel shortly after the webinar is complete. You can submit questions at any time using the Q&A box, and they will be answered at the end of the panel presentation. If you're on Twitter, please use CDP for Recovery to share and join the discussion. If you're like most of us at CDP, since the pandemic started, you've lost track of time. You're struggling with the new ways of having to be physically distant from friends and family. You're missing your usual social activities, and you wonder how long this will go on. Some days we look back and wonder how we're even still in 2020. So far this year, CDP staff have worked on 12 new catastrophic disasters, many previous year's disasters, and 6 complex humanitarian emergencies. That doesn't include all of the smaller Midwest disasters our early recovery team has responded to, and it's still only September. Disasters are often multiple crises tied together by geography or hazard. In fact, of those 12 catastrophic disasters, we've included all the hurricanes as one line of work, and the same with wildfires. We struggle to believe that it was only January 2020 when the massive wildfires in Australia blazed, or when Puerto Rico was struck by the devastating series of earthquakes. Everyone is waiting for 2020 to be over, but we're wondering if 2020 is actually the beginning of the new reality. Climate change has created a world susceptible to more and bigger disasters. As philanthropists, we need to figure out how to respond effectively. In today's webinar, some of CDP's staff will share their experience and try to puzzle out this issue. Our goal is to provide our listeners with tips, lessons, and recommendations based on our combined dozens of years of experience in the disaster, humanitarian aid, and philanthropy spheres. So what hazards and disasters have we seen this year that has us so concerned about climate change? Obviously, COVID-19 has been the disaster that is undergirding everything we do, both at work and personally. It has impacted our lives in a way that very little has in our current lifetime. As of this morning, September 24th, there are 32.1 million cases in the world with 983,000 deaths and 23.7 million recoveries. The U.S. has over 7.1 million cases, nearly 207,000 deaths, and 4.4 million recoveries. About 1,000 people are dying daily in the U.S., and we're seeing around 40,000 new cases. The next highest is India at 5.7 million current cases and an average of 90,000 cases daily. It is likely that India will surpass the U.S. in about 3.5 weeks in terms of pure numbers, but that is to be expected with the population of India. On a per capita basis, however, India remains behind the U.S., with the U.S. at 21,600 cases per million people, with India at 4,100 cases per million people. There are also dozens of major fires currently burning across North America, especially on the West Coast of the United States. The current 77 fires have burned over 3.7 million acres, but the year-to-date total shows that almost 44,000 fires have burned over 7.1 million acres. This is 1 million acres more than the 10-year average, and this week marked the beginning of the fire season. California has been hardest hit with 8,000 incidences and over 3.6 million acres burned, making it the worst year ever for amount of damaged land. Already, there have been almost 7,200 structures damaged or destroyed and 26 fatalities. The first, third, and fourth largest fires are currently burning or have been contained this year. The most unusual hazard we're going to talk about today is the Midwest derecho. Derecho is a line of intense, long-lived, and widespread thunderstorms that move quickly across a long distance. Unlike a hurricane, it produces straight-line winds. While unusual, there are 7 multi-state derechos across the U.S. between the end of April and the middle of July 2020. The Midwest derecho on August 10th was the 8th, but the main attention getter because of its intensity, size, and damage. It traveled 770 miles in 14 hours at an average speed of 55 miles per hour, with the winds of up to 140 miles per hour at times. While it crossed several states, the most significant damage was seen in Iowa. To date, there have been 24 tropical depressions, of which 23 became named tropical storms. 8 became hurricanes, including 2 major hurricanes. The most recent storm is Beta, the second letter of the Greek alphabet, which is used when the list of names designated for the season is finished. The last time this happened was 2005, when Zeta was the last storm. Through the first part of 2020, the impact of the Atlantic hurricane season was minor, with less than $1 billion in total reported damage through July 27th. However, later storms, beginning with Hurricane Isaias, were more damaging, with current assessments coming in close to $6 billion, and Hurricane Laura at $10 to $12 billion. It is estimated that the damage from Hurricane Sally will be $8 to $10 billion. As of September 24th, a bit of good news, the National Hurricane Center is not monitoring any storms, and this is for the first time in months. Now I would like to introduce the CDP staff members who are joining us today. Brennan Banks is the director of CDP's Recovery Fund. Brennan brings his disaster management cycle expertise to all aspects of CDP's disaster funds and associated grant making and grants management. Carrie Cullen is the program manager for the Midwest Early Recovery Fund. She is focused on understanding and addressing the unique needs of communities and individuals in disaster recovery and fostering the assets and strengths of the community and individuals to build capacity and strengthen their resilience. Sally Ray is the Director of Strategic Initiative and oversees the Hurricane Harvey Recovery Fund and the CDP COVID-19 Response Fund. Sally is familiar with the long-term effects disasters can have on communities and is keenly aware of how long it takes communities to return to normal or a new normal after a disaster. Tanya Gulliver Garcia is the Assistant Director of Major Initiatives. Her work is grounded in principles of equity and an understanding of how the intersections of race, gender, sexual orientation, age, disability, class, etc. impact the lives of individuals and their families and communities. Welcome, everyone. Sally, let's start with you. You've been directing our COVID-19 Response Fund, which has granted out over $17 million so far. As a response versus recovery fund, this is a very different territory for CDP. What did you have to do differently to feel you were being successful in your grant making?
Thanks for asking, Patty. Yes, the COVID Response Fund is quite different from anything I've done before. As you mentioned, with the Hurricane Harvey Recovery Fund, we focused on mid to long-term recovery. We made our first round of grants 6 months post-storm and just made the last round of grants last November. We still have active and engaged grantees from Harvey focused on long-term recovery in Texas more than 3 years after the storm, and we will have those grantees working through 2021. With the COVID fund, though, we knew we needed to act quickly in order to hopefully mitigate the need for a longer-term recovery. As a global response fund, this was a new way of grant making for me personally. I was so grateful to have the opportunity to tap into the expertise we have at CDP with our team members, many of whom are on this webinar today. They've been a real guiding light to my work. Through this consultation with the team and others, we determined that we would focus our early rounds on containment, safety, sharing appropriate information, and addressing immediate and basic needs. Our first 5 rounds were what we called rapid response grant making. We sort of stepped out of our usual processes. We allowed simpler proposals and some quicker review processes. And as a result, we had 41 grantees and more than $10 million out the door by the 1st of June. We've slowed that process down now, thank goodness, and have turned our eyes more toward recovery for subsequent rounds. So with Harvey, I practiced what we call shoe leather philanthropy, meaning I live in Texas. I personally visit all 41 affected counties. I met with local leaders, fellow funders, and prospective grantees in person, and I knew the people in the projects very well before we funded. That simply isn't possible with a global fund during a pandemic. So instead, I've practiced what I call Zoom leather philanthropy. Since March, I've had about 270 or more Zoom meetings with community leaders in hotspot areas, with fellow funders, with potential grantees, all to have a better understanding of what the needs are globally and to have a better idea of how our funding can be more strategically directed. Our global focus with this fund required that we approach things differently this time.
So Sally, what about your grantees? Did they also have to change their model of response given the pandemic?
Our grantees were quick to identify that they also had to think differently, to do things differently than before. So how could they access those who had the greatest needs with social distancing protocols? For instance, congregate meal services for the elderly had to be reconsidered. So drive-through or walk-up meals were quickly put in place along with an expansion of direct meal delivery. And how could you keep volunteers and staff safe, especially when many volunteers are elderly and in the most at-risk group? A quick widening of the net to reach additional volunteers, coordinating with volunteer coordination groups, and a big effort to keep everyone safe helped with that. And many organizations had to do an even bigger pivot of their programs. Clinics had to quickly find ways to offer telehealth or telemental health programs. And direct delivery of cash assistance had to be done electronically as well. I was so impressed with the creative ways many organizations still found to reach those they serve. And I suspect some of this will stay the norm, or at least as an option as we move forward.
Tanya, a similar question. As a Louisiana resident, what are you seeing on the ground that is different in Hurricane Laura response than in previous disasters? And how are NGOs and philanthropy responding differently to that?
Thanks, Patty. I think for me, a lot of the things that Sally mentioned are definitely true. And just a few examples. The Greater New Orleans Community Foundation pre-positioned disaster response funds now, which meant that money was able to move within the first couple days, even before the storm made landfall. That's unusual, I think, for philanthropy. We saw a lot of collaboration. The Baton Rouge Area Foundation partnered with the Southwest Louisiana Community Foundation so that BRAF took on some of the administrative components of the work since Southwest was so impacted by the storm. And other foundations in the state and in Baton Rouge, such as Pennington Foundation, with our board chair, Lori Burtman, offered support and technical assistance as well. With the NGOs, we also saw a lot of virtual deployments. So instead of being on the ground, people that could were working from their own homes. And this saved not only travel and housing, but also money and time getting people on the ground. There was a lot of coordination amongst NGOs. I think that first weekend before landfall, I was on at least 5 different VOAD calls, so voluntary organizations active in disasters, some at the state level, some in different regions where the storm was guessed that it would impact. And then the other thing that has been really interesting, both through COVID and also with this hurricane response, has been the uprising of mutual aid groups. So mutual aid groups are not formal NGOs, but they're recognizing the strengths and assets that exist in the community to provide for themselves. And through Sally's COVID-19 fund, CDP made a grant to Imagine Waterworks, which is one of the groups active in New Orleans that has been doing a lot of mutual aid through COVID. But because of their primary work being in water management and hurricanes, they pivoted and have been doing response. New Orleans saw over 12,000 evacuees come from the Lake Charles and Southwest Louisiana area who had to be housed in hotels. Again, a difference because there was no congregate sheltering. The mutual aid allowed us to see that impacted populations from Katrina have a real concrete opportunity to meet the needs of evacuees. And in many times, this was in ways that they wish their needs had been met during their evacuation. And it flipped disaster response from what NGOs or philanthropy may think is needed to what the impacted populations told us they want. And so people would just write into a Facebook list and say, I need a fridge, I need a hot plate, I need a microwave. And those are actually the top 3 requested items even before close. It was how to get their essential needs met while they were in the hotel.
No, that's really interesting. Thank you, Tanya. Brennan, you've done a lot of collaborative work with both your grantees and with philanthropy, connecting with local community foundations to strengthen local philanthropic efforts. Can you describe some of the work you've done in previous wildfires and so far this year with partners, philanthropic partners?
Sure, thanks, Patty, and good afternoon to everyone on the call today. First, I just want to highlight, every too often, local community foundations are all dressed up and they're ready to impress. They just need a disaster head on their shoulders, because this is new territory for some of them, and a comfortable chair to support them and their work as they continue to work with their communities. For CDP, a big piece of our approach and added value comes with our work in partnerships with these local philanthropies, whether it's the North Valley Community Foundation with the Campfire in Butte County, or more recently, the Community Foundation Santa Cruz County and their recent complex fires. Local community foundations are often thrusted into leading their communities' relief and recovery efforts in a post-disaster environment. Again, for CDP, our initial outreach and then our entry point into disasters quite often is through our network of local community foundations. We feel that these key community stakeholders have the pre-disaster knowledge and relationships needed to more effectively coordinate disaster relief and recovery in their communities. Community foundations are just so incredibly vital for the far majority of our recovery activities, and more importantly, to make them sustainable and lasting recovery impacts in those communities. But most importantly, these community foundations are exactly the type of infrastructure a community needs to start with the immediate relief phase and provide the foundation for recovery planning and coordination that follows. As part of our localization agenda, here at CDP, we of course, try to prioritize local nonprofits and community-based organizations that were part of their communities prior to the disaster, and have those key relationships and knowledge needed for truly effective and efficient post-disaster relief and recovery interventions. And this, again, is why relationships with local philanthropy, including community foundations, are so important. They know their local humanitarian actors and nonprofits. They know the stakeholders. They know the local politics, too, which can be important in some cases. They are, in most cases, the most reliable and consistent partner for many external funders and organizations wanting to help or get involved. And, furthermore, I think it's important to highlight CDP's and really what should be everyone's commitment to fair and equitable disaster management support, assistance, and resources. Through our collaborative work with Indigenous, Brown, and Black communities, and the philanthropies and the NGOs that target them, we are able to ensure that philanthropies and organizations specifically targeting these populations are also supported and also have their share to disaster dollars and philanthropic support. And this is, similar to what we've done recently in partnership with Google.org with the Latino Community Foundation in California for the current wildfires in the state there. And also through our CDP Atlantic Hurricane Season Fund for the Lumbee Tribe of North Carolina, which was done in partnership with community organized response effort. So, those are just a few examples, but, I cannot stress how important it is to really engage local philanthropy and use them to help you better understand what that local environment and the local needs and the context is as it relates to any disaster philanthropy is looking at.
And what about NGOs, Brennan? I mean, how have you been able to build collaboration with them?
Well, it starts with sort of trying to assess, the situation through a local lens. And as I, talking about local philanthropies and foundations, I also use our nonprofit and NGO partners to assess what's going on the ground. And just jokingly with my image there, I want to know, what is the coconut doing on the ground? I want to get the temperature of the situation on the ground. Most of my work with disaster grant making, it revolves around long-term recovery. And before I can even move into having meaningful work as it relates to a new disaster, a new community, maybe even a new country, I want to try to make sure as best as possible to look at the situation through a local lens, and not necessarily how you or I might feel about a situation, sometimes viewing the situation from thousands of miles away. So this photo from St. Croix, but I'm sure many of you have seen this in many bars across the Caribbean. It lays out the simplest terms for how weather can be forecast for that community. There is nothing necessarily wrong with it. It just has the most simple timelines and visual indicators, and is only applicable for what they view as their specific hazard, which is tropical storms in the case of the many Caribbean islands. I share all of this because it also highlights my approach, again, to building collaboration with NGOs for recovery programs. For me, it's important to reach out and learn, again, as much as I can from those on the ground that can help to paint that picture of what the community is, what their needs are, their priorities, but more importantly for me, again, looking at long-term recovery, where are the gaps? And we want to make sure that we can identify those priorities and gaps as it relates to recovery, and try to address them. And again, we need to know, what is the coconut doing on the ground? What's happening on the ground? So, you know, the philanthropic collaboration I briefly mentioned a moment ago, for me, it's the tip of the iceberg. Much of our success has revolved around connecting to, you know, the support for the foundation and the frameworks for a lot of the nonprofits and NGOs on the ground, whether it's through targeted support and advocacy for a long-term recovery group somewhere in the US, or it could be a more international partnership, you know, like a recent collaboration for Hurricane Dorian recovery in the Bahamas, which was a sort of a partnership with GER3, the Rocky Mountain Institute, Water Mission, and Friends of the Environment, where we provided 4 separate grants to these organizations implementing separate recovery programs, or had plans in place for 4 separate recovery programs. But these programs had a common intersection. And that common intersection in this case was rebuilding more sustainable and resilient schools, and with expanded environmental conservation activities and awareness programs for the youth linked to education, linked to those schools. For me, this was such a fantastic example of philanthropy being smart, being thoughtful, and being patient to identify and encourage some of the nonprofits and NGOs, both local and international, to share and coordinate plans whose collective impact would be far greater and more sustainable because of their partnership and their collaboration. Now, I admit, as a former, you know, humanitarian programs manager, I believe firmly that philanthropy should not dictate response and recovery programs, but they should approach grant making as investments and use their resources to encourage and foster more efficient collaborations amongst NGOs and their investments. So in conclusion, Patty, you know, for me, it's all about smart philanthropy. And smart philanthropy uses its networks, relationships in the NGO space, as well as the local philanthropy and community foundations referenced before, to identify opportunities to maximize humanitarian service delivery efficiency and back it up with funding. But first, you must find out what the coconut is doing and follow its lead.
Yeah, I like the coconut. It's a great way to keep things in perspective. Carrie, I want to bring you into the conversation. The Midwest Early Recovery Fund focuses on collaboration as a key part of its work. And given the pandemic, the response has been slower to help Iowa recover from the derecho. What can philanthropy do? How can we help out with this pause or gap? And how do we help collaborate for recovery?
Yeah, thank you, Patty. I think I would just echo a lot of what Brendan just spoke about, but also just add to that. In my experience and in the Midwest, you know, this space before recovery it always takes longer than we want it to. But there's almost always this period of time, and we call it early recovery because we're the Early Recovery Fund. But this is the space where we just really feel this urgency to get started, but we really need to take a little bit of a pause. And to just really ensure that where our investments, they're going to the needs that will not or cannot be filled by the government or insurance. So during this time, we really encourage our funders and partners not to take a complete pause, but to start out by supporting those nonprofits, those community champions in those communities that are already serving those impacted vulnerable populations. We encourage the support of them by ensuring that they can meet those basic needs. And one of the unique things I think we're seeing more and more with the pandemic and the derecho in Iowa is that food is becoming even a more of a need and a longer sustained need for people. So we have to meet those basic needs of people. And then we need to give those support to them as they start to advocate on behalf of their clients for resources. So it's really about developing those resources that are needed for the long term. And we need to think about meeting those intangible needs, mental health and psychosocial support. For much of the region that I work in, capacity often looks like staffing. And I would say that now during COVID, I would add this idea of general operating expenses. The nonprofits that we are looking to partner with and talk to are tipped over already. And so as much as we can to shore up what's happening there and to encourage their ongoing work so they can stay. So we do a lot of encouraging funders to collaborate. We've seen some great success throughout our region. With convenings, we used to do them in person, now we do them over Zoom, but just encouraging people to get together. These conversations continue in Nebraska. We've probably all forgotten and moved on, but there was a significant flooding throughout the Midwest in 2019. And these conversations have started in Iowa with some really fantastic local community foundations who are leading the way. This space to collaborate allows us for the time to collect that information that we need and to identify those gaps, as Brendan was talking about. It often allows us the time to start to advocate to the government, to local, state, federal government, that they need to do their part and they need to do it equitably. It gives us a chance to start to elevate the story of the community so we get the attention that we need for these low attention disasters that happen in our region. And it's the time for us to start discussing who's going to do what and how they're going to do it. For us, really, the #1 goal should be that we're making a plan for recovery and that we're working to ensure that everyone receives equitable access to the resources that will be provided as we go along.
So Carrie, you often support needs assessments for philanthropy and to build an understanding of what's happening in the disaster. How has this changed in light of COVID, and what are you doing now to adapt?
Yeah, so you know, as these disasters continue to intensify and they layer on top of each other, I really think that assessment and then response and recovery that comes with it, it really needs to become even more local. And it's going to be more and more important for us to give the community the tools that they need to collect their own information and to own their own data information. They need to be able to tell their story well. So we can no longer go in person sometimes to do this needs assessment. So we're trying to give more and more tools to those on the ground to be able to do that for us. In light of COVID, I really think that we need to start thinking about needs assessment a little bit differently. And we really need to make sure that the burden of this data collection doesn't fall heavily on those who are frontline service providers. So we are working to have creative and user-friendly and smart ways of collecting and sharing information. I think we need to be more and more comfortable sometimes with estimates and general numbers versus some of those verified hard data that I often hear that people are looking for. And again, we need these tools so that we can do ongoing needs assessment. It can't be a one-time thing. It has to be cyclical. And then that needs assessment needs to lead us to consider more than just the immediate impact of the disaster, the things that we can see. We need to start to look at what are the cascading impacts on the whole community and what are the implications of this disaster in that community long term. So our Early Recovery Fund team is working really hard to provide access to more technology and tools and to encourage supported local data collection and ownership, and then the coordination between local service providers, funders, and professional disaster response systems.
That's some really great clues for others in terms of things that you can adapt and look at as well. And Tanya, let's go back to you. Your role at CDP includes understanding what NGOs are doing to respond to disasters. What trends are you noticing in response, given both the numerous hurricanes and the other disasters, including COVID?
Yeah, I think, you know, you mentioned at the beginning, Patty, that CDP staff had responded to 12 catastrophic disasters plus complex humanitarian emergencies and last year's disasters. And that's true for all of these NGOs, especially national or international responding organizations. And for some of them, they've responded to even more because they're involved in humanitarian aid and working in countries going back years. So when I talk to folks, they're exhausted. They are stretched beyond their limits, both in terms of time and staff capacity, financially, just what they're able to do. They're having to make, as I think many of us have had to make recently, some really hard choices about, are they going to activate for a specific disaster, or do they just have to sit this one out and hope that someone else can pick up the pieces? And if the funding doesn't come through for a specific disaster, what they're able to do, may be really small, not their usual response, and that can be really hard for them. And especially with COVID, folks are struggling with the essentials. Everyone who responded to Hurricane Laura had to be self-contained because there was no power and there was no water. And so I know of one group that wanted to and had multiple kitchens, mobile kitchens available to come in. They had the staff resources, and they had to put a hold on it because they needed to first bring in some housing units and some bathroom units. They needed a place for their staff and their volunteers to do that cooking. And so that just delayed the resources getting to the community. And I think what's been hard in conversations with a lot of NGOs, those of us who've been in the field for a long time, we do this work because we love getting up close and personal with people. And with COVID, we're at least 6 feet away, and you can't give that hug, and you're wearing a mask, and your clients are hopefully wearing a mask, and you just can't engage in the way that you normally would. And emotionally, that's really hard, disaster after disaster after disaster. But at the same time, there is amazing work happening. I love getting the reports from the NGOs and seeing the stories and the photos of what they're doing and how they're figuring out how to function in this new environment. The new partnerships, and Brennan talked about a couple of them, but just the way we've seen with COVID, a group that maybe does congregate feeding partnering with another group that does mobile feeding. So they're both able to expand their reach. And I really hope these new ways of working continue after COVID, because if there is an after. But collaboration and supporting each other is just so critical for getting this work. And, the work is getting done. Maybe it's not as fast, as Sally said, as we would like it to be. Things are a little bit slower in a COVID environment. But these NGOs and faith communities and volunteers are on the ground, and they are making a tremendous difference.
Now, it's really always important to keep that positive spin to it. Otherwise, we won't be able to get beyond the numbers and the need. But one thing I've noticed, Tanya, is that Hurricane Laura didn't get a lot of attention from media, and it seems to have vanished despite the immense damage it caused, or the needs have vanished. Why do you think that is?
Well, those of us in Louisiana would probably say because we're in Louisiana. This tends to happen with a lot of our disasters where it takes days, and Carrie probably would say the same for the Midwest. It just takes forever for people to notice that something happened because we're 4 million people in the whole state. We don't have a lot of population. There was that initial flurry of attention when it looks like it was going to have a direct impact as a Category 4, a Category 5, and that creates pictures, that's images, that's people in danger. The news picks up on that kind of thing, sadly, rather than, the real impact of a Category 4 or 5. Jim Cantori came to Lake Charles, and in disaster and weather circles, that's always a bad sign. You always want to not have him come to your town. There were fears of massive flooding, and there was massive flooding, but there was a slight jog in the storm that meant it didn't hit as populated of an area, and the timing meant that the flooding wasn't as big and dramatic as it was expected to be. And the governor said in a press conference right after the storm, we dodged a bullet. I think when the governor says that, media pays attention, and they don't perhaps follow up with their concerns about the community. But just because the bullet didn't kill anyone doesn't mean it didn't hit anyone. We dodged a bullet in the sense that we weren't in 20 feet of water, but we were still in 10 feet of water, and some places were in 20 feet of water. We dodged a bullet in the sense of it hit Southwest Louisiana, which is a less populated area, versus hitting a major city like New Orleans. But that doesn't mean that those folks who are living in Calcasieu and Beauregard and Cameron parishes weren't just as impacted as we would have been here in New Orleans. There was a lot of focus from media on Lake Charles, which was the biggest population. And the damage wasn't as shocking there. Lots of damage, but not as visible as the really affected areas, but nobody could get into them. And so media isn't going to stay on the ground. And then really a lot of it comes to the public. We don't pay attention for very long to any one issue, and that is particularly true in an election year. It's always hard to talk about disasters during an election, especially, I would say, this year.
Carrie, like Hurricane Laura, it took days for the mainstream national media to pick up on the derecho, and the attention disappeared even quicker than it had for Hurricane Laura. Why didn't the derecho get the attention it needed?
Well, I think one of the things would be that that's pretty normal for us in the Midwest. We see a lot of low attention disasters that just really don't make it to the mainstream media. And there was some attention. I would say, you know, Cedar Rapids did get some attention eventually, but in the same way as Louisiana, there were many smaller communities and areas surrounding where these are low attention disasters within an already low attention disaster that we're working to just really understand and pay attention to. So, but a few things that I think made this a little bit unique as far as low attention disasters is one of the things was we initially noticed it as an agricultural disaster only. So even myself, whose job it is to look at for low attention disasters in the Midwest and pay attention to them, when I first saw this, I went, oh, it was an agricultural loss, which at the end of the day is actually a big deal. So we assume that crop insurance is going to cover all of those losses, but really only 70 to 90% of those crop losses will be covered by insurance. And those losses extend far beyond the loss of corn. They're going to impact the economy of Iowa and the region and probably the whole United States for quite a while and for years to come. So I think the other thing is as a nation, we just really have disaster fatigue right now. And that's no different in Iowa. For Iowa, this is a disaster and its challenges fall into those already existing crisis points. They're recovering from 2019 flooding. There's a ongoing housing crisis in rural America that is just really exacerbating these issues around finding places for people to live after this storm. And then there's COVID, which is the underlying story for every story that we're telling. So one of the things though that I just want to share that we did see, and we've seen it in Nebraska as well, is communities that we've provided capacity building support for in the past were much faster to sound their alarm and to ask and request for that attention that they need. So one of those communities was Marshalltown, Iowa. We've been working there and helping with the recovery from a 2018 tornado. I've seen they now have a skill set and this potential to recover faster because of the investments in local capacity and mitigation. And so I would just say that past disasters have provided some opportunities for us to move forward and to be more ready for the next disaster as it comes along.
And that's a really great point, Carrie, because it's a key learning that CDP brings forward all the time is investments now in these communities and in these cyclical areas can have long-term returns. And I think, in terms of attention for disasters, Sally, you had a very different experience with Hurricane Harvey in 2017. It did receive a lot of attention. So let's come back to you and the work you've done leading CDP's Hurricane Harvey Fund. How did the funds you were able to invest in grantees during that recovery phase, how have it helped them position them to better respond to COVID and other disasters?
You've heard several of us speak about building capacity, building that local capacity. And as I mentioned earlier, I was able to get to know our Hurricane Harvey Fund grantees really well, thanks to that shoe leather philanthropy I spoke about. And a lot of what we funded through the Harvey Fund was meant to build the capacity of those local organizations to be able to respond not just to Harvey, but to future events that affect their communities as well. I've been so very pleased and proud to see several of our Harvey grantees step up, respond, and help their communities begin to recover, not just from the pandemic, but from other storms and disasters that have hit their communities. The pictures you're seeing in this slide are from some of these groups. The first one there on the left is from Houston Responds, who coordinates faith-based networks of volunteers throughout the greater Houston area. They work with churches to collaborate and build their volunteer networks. You'll notice in this picture, they're using younger volunteers to work on a Harvey home repair, and they're keeping them safe with masks and distancing. They've also pivoted and responded and expanded their work, even collecting and distributing masks throughout the region and still providing training to their congregations who they work with electronically and from a distance, and providing guidance to their groups on how best to practice good COVID protocol. In the second picture, you see two of our long-term recovery group grantees, Orange County Disaster Rebuild and Hardin County Strong. They've responded to multiple disasters since Harvey, thanks to the capacity they've built through our funding and other funding that they received. And they also work closely together to support one another during crises. These are counties that are right next to each other. And they also, this photo was taken as they responded to the impact of Hurricane Laura, which also hit Orange County in Texas, not just Louisiana. And the last one on the right there is from Attack Poverty, which has been able to expand their reach beyond Fort Bend County here in Texas to many other Texas communities and even into Louisiana to support Laura recovery. They also work internationally. They've been addressing basic needs like food insecurity in the communities they serve throughout the pandemic. And these are just a few examples of these great organizations whose capacity has been built. Building local capacity has allowed all of these groups and others to continue to do the work, the important work of recovery, even beyond their local reach and even beyond the funding that we provided for them.
Well, that's amazing. Brennan, I know you've been thinking about how your grants and the Wildfire Recovery Fund can prepare organizations and philanthropy to better respond to what is clearly an impact of climate change, ongoing bigger fires, a longer fire season. What does that look like as a grant maker, and what should other philanthropies be thinking about?
Thanks, Patty. And I have to be careful. I don't want to be a politician and hop on my soapbox here. But for me, it's all about looking at the common denominator and trying to find the most common intersection for all of these disasters, emergencies, impacts that we're seeing in 2020. Many of our philanthropic partners continue to struggle, with what has been overwhelming needs in 2020. And they keep asking themselves, how do I separate support and or recovery assistance from Hurricane Laura versus COVID-19, or economic hardship that started from COVID-19 but was multiplied by a recent evacuation from a wildfire in the West Coast. Disasters are no longer limited to a clear impact or a single scar left behind. Our growing severity and frequency of hazards, such as hurricanes and wildfires, are increasingly unearthing the layers of many of our pre-existing, pre-disaster socioeconomic challenges and shocks that many families are faced with every day. While it is easy for me to share such an observation, the more important angle for us to look at is what we are witnessing as it relates to disasters and climate change. And I believe the common denominator for 2020 and life as we know it going forward, and Tanya, yes, there will be life after 2020. We're optimistic. But I think the common denominator is really environmental health. And I think this includes COVID-19, and it includes future pandemics and other health emergencies that will come, that are inevitable. Environmental health is defined as the branch of public health that focuses on interrelationships between people and their environment. It promotes human health and well-being while fostering healthy and safe communities. Environmental health is the intersection of how we live with and treat the environment around us, which in return, it directly influences the climate change that we are seeing in 2020. have always talked about climate change mitigation. We've always talked about climate change adaptation measures. And of course, larger scale physical infrastructure needs more government funding for some of these initiatives. But myself, having managed community level CCM and CCA programs within those sectors and also across those sectors, I definitely know that what we need now are more healthier populations and the community level foundations for what we like to very liberally refer to as strong and resilient communities. But again, this starts with healthy communities, as well as some minimum basic income guarantees from society and the private sector. In addition to more committed investments in disaster prevention and mitigation efforts, is what we need as we move forward. The reality is we're not going to stop larger, more frequent firestorms and thunderstorms and so forth. We must accept where we are today, here in 2020. I think, in 2000, we had these visions of what 2030 and 2040 are going to be like as it relates to climate change. We're already there, and it's 2020. So we need to start prioritizing how do we reduce the loss of life and property from wildfires and severe weather events, full stop. One could even add the social economic injustices that we see, in the U.S. and link that to environmental health. Many of the unfortunate disparities in society are linked to underlying health issues. And again, just look at COVID-19. Why are we seeing more indigenous or higher percentages of indigenous, brown, and black persons in the U.S. having higher case fatality rates than their white counterparts? In short, in conclusion, I'm recommending that philanthropy and disaster management stakeholders continue to view, programming priorities through that of a environmental health lens to better identify and promote the innovative, progressive, more intersectional investments that make the transformation we need in order to create more equitable, healthy, and disaster-ready communities, which are required now.
Right. No, that's a great point. I want to pull in a question from the audience now, if I may. Sally, I'm going to bring it to you. I mean, you're working on COVID. It's kind of a up there and everywhere kind of crisis, but meanwhile, there's all these other crises happening as we addressed. What suggestions would you give regarding ensuring that there's awareness about the crisis? How are we making sure people are knowing about the additional needs that are out there? Do you have any tips you would give?
That's a tough one, Patty, because as we've seen an awful lot of disinformation or misinformation about the pandemic itself being distributed nationally and internationally. So I think grounding yourself in science is important, and making sure that you're elevating and communicating the data and the information that you know to be true, because it's based on reality, it's based on science. So I think social media can be a beautiful and amazing tool in a lot of ways in communication, but it can also do a disservice to all of us in sharing and spreading misinformation and disinformation so quickly. So being aware and attentive to reality and truth and data and science is really critical, particularly in light of the pandemic, but certainly with any of the disasters we're experiencing as well.
Thank you. And Tanya, you're kind of our disaster guru. You're watching all the time for us and keeping, looking what's happening ahead. But none of us know what the future will bring. But how do you envision natural hazards are going to be changing in the coming years? And just to tie in a question from the audience to that, do you fear that we'll run out of philanthropic dollars to match or mitigate the harm that those are doing?
Well, I think it's pretty clear that natural hazards are going to be more frequent, and that means that disasters are going to be more frequent. And, we sometimes conflate the two, but the natural hazard is just the event, right? If a tree falls in the forest, doesn't make a sound. If an earthquake happens in an unpopulated area, it's just a hazard. It's not necessarily a disaster. But we are building on dangerous land. I live in a swamp. I'm 8 feet below sea level where I'm talking to you from right now. So there is a risk as we continue to expand around the world in dangerous situations that these hazards are going to impact us. Climate change is going to impact us. We are not out of money, but we're not spending the money. So what we saw with COVID is, there are many, many billionaires, and most of them made smaller donations. Jack Dorsey gave over a quarter of his fortune to COVID relief. He's the founder of Twitter and Square, $1 billion. But he was the only one giving that sum of money. There is a lot of money in donor advised funds. There are foundation endowments that could be increased. So there is money out there, and we just need to pull from it, because it is hard for the smaller individual who maybe got laid off through COVID or is really struggling with the increased cost of food to be the ones supporting all of these NGOs and solving the disaster problems.
And that's a really great point, because it's not only the philanthropists who have these funds that the big numbers come out, but with Halloween approaching, I don't know if people are aware of this, but the U.S., we spend $9 billion a year on just Halloween one day, right? So candy and costumes and parties and the rest. And if we just think about where are we and how we spend our funding and where we give and what we think of as important as a society, not that I'm anti-Halloween, but just that I think there's a lot that can happen there in terms of, as you said, there is money. It's where the money goes and how it's being spent that is so critical as we look for solutions. Brendan, I'm going to come to you with our last question here, because you speak to community foundations as a vehicle in collaboration. There was a specific question about the local Salvation Army. I think it can go on from there in terms of other community groups and faith-based groups in areas. Would you talk a little bit about that as well?
Yeah, for me, the local community foundations quite often, and I would say them as well as long-term recovery groups, which we don't talk enough or highlight enough. But these two entities are really key in both providing the foundations for local nonprofits, including Salvation Army, to come to the table and be made aware of funding opportunities. But more importantly, they provide an avenue, foundation, if you will, to highlight the community's needs, highlight the nonprofits, the organizations that are still engaged and what they're doing and what their needs are. So for me, it's really important that the community foundations, as well as the long-term recovery groups, which in some case can be one and the same, that we are amplifying them. We're amplifying their voices, we're amplifying their positions, what they're doing, so that in return, maybe there are you or funders or other partners that might be outside of those communities, not from those communities, but wanting, willing, and able to help. But how do we ensure that they are aware of those actors on the ground, what their needs are? And again, I think that's an important role that I take on personally, and I know CDP, my colleagues take on, is being that bridge, between U.S. funders and larger philanthropy and the local philanthropy and local nonprofits. But again, the community foundations are a very important vehicle, as well as involvement of your local long-term recovery groups.
And just in closing out your remarks, if everyone could just give one sentence, one recommendation that they would give to the community on the phone here. Carrie?
I guess I would just say that it's time for us to start collecting data and being able to share what we know. And that's one of the best ways. If we can tell the truth about what's happening on the ground, people will pay attention.
Tanya?
I think I would say that this is the rainy day, or perhaps the rainy season, and it's time to dig a little deeper.
Brennan?
As a former emergency manager, I can only tell you that, some years are better than others. And 2020 is a major test for this country and for the world, but we'll get through it. And we'll have to pick up the pieces and move forward. But it's also an opportunity for innovation in how we do things and how we support our communities.
And Sally?
I would say let's not be afraid to fund advocacy, to elevate other voices, and to make sure that we're communicating the needs of those who are most disproportionately affected through advocating for those needs.
Thank you. As we begin to wrap up, just to summarize a few and add to what my colleagues have already said here in terms of some takeaways from the conversation. Be strategic about your giving. Don't just react to the newest media report. Save some money for recovery. Think about how to balance the current, ongoing, and long-term needs. Support local organizations, especially those serving the most vulnerable populations during disaster, such as communities of color, the elderly, and people with disabilities. We just can't stress that enough. Philanthropy is about more than money. Political advocacy, as Sally said, technical assistance can be as important as financial support. Support your grantees in non-financial ways as well as financial. Do you have expertise on your staff or board that can help them out? Can you convene multiple grantees or funders to share issues or plan a coordinated response, as were some of the examples earlier? Collaboration is key. Collaborate with other funders to help do more with less. This can not only reduce duplication, but it can make the process overall smoother for your grantees. Climate change is real. It's making disasters bigger and more frequent. This is a reality that we're going to have to contend with as funders from now on. Fund mitigation and preparedness activities to diminish the impact of natural hazards on communities. As Tanya said, a hazard by itself does not have to result in disasters for communities. Think outside the box. Just as we always say that all funders are disaster funders, increasingly many NGOs are responding to the increased needs of their communities caused by disasters. Look to your core community groups to see how they have been impacted by disaster and see how you can help. Remember that message that came out quite a few times: capacity, capacity, capacity. Helping in one way now will result in helping in another way later, if you can really help these organizations build and grow and become more sustainable. As our panelists have shared, there will be ongoing needs to assist with recovery efforts for years to come. There were additional questions we didn't get to, but CDP has many resources, including several funds devoted to disaster philanthropy that can assist you. Our Issues Insights provides an introductory look at disasters and responses. We have recordings of past webinars that you can view or even just listen to while you're on a walk. Our disaster profiles provide regular information about the impact of a disaster and the needs of the community to inform philanthropy on how you can help. Our staff are always available to provide guidance, as you heard from them today. You know the depth of their experience, the context that they have. Please do reach out to them. You can find more information about our work as well as contact details for individuals on our website, www.disasterphilanthropy.org. To those of you who may be planning disaster response funding, CDP has many additional resources and information in our disaster playbook. You can find that at disasterplaybook.org. In order to respect everyone's time and keep this to an hour, unfortunately, this is all the time we have today for our webinar. I want to thank Brennan, Carrie, Sally, and Tanya for taking time to share their insights and for being incredible colleagues to myself. It's really a pleasure to work with all of them. A special thanks to our co-sponsors, United Philanthropy Forum, Council on Foundations, the Funders Network for Smart Growth and Livable Communities, Philanthropy California, the Iowa Council of Foundations, Southeastern Council of Foundations, Grantmakers in Health, and the Community Foundation of Southwest Louisiana. If your questions or thoughts that were not addressed during today's webinar, you can also email them to Tanya at tanya.gulliver-garcia@disasterphilanthropy.org. Thank you and have a great afternoon.